Well, welcome everybody. Appreciate joining us today to talk through Medicare Advantage Headwinds. I know that that's been a prominent topic as part of the conference this week. And in reference to that, we're really trying to stage that as it relates to MedSupp and whether those represent headwinds or tailwinds for MedSupp as well. My name's Nick Orner. I'm a consulting actuary with Milliman. I'm out of our Milwaukee office. I work extensively in the Medicare space. I have a deep background as well, working as liaison and working directly with producers and distribution as well. So I think this is a good mix, a good match for me and the individuals on our stage. I'll allow each of them briefly introduce themselves as well. Chad?
Yes, thanks, Nick. Chad Wells, Chief Marketing Officer at Physicians Mutual. Hopefully you all have been able to enjoy some of the champagne we've had there. I have been here for about 9 months, been in insurance and Medicare for 20 plus years. And in my role, I oversee product sales and marketing. So it's a little unique in the CMO sense, and look forward to the time. Thank you all for investing the time here.
Hey all, my name is Mike Hardle, function as President of Sales or the Chief Revenue Officer, part owner of Agent Boost Marketing. We're an FMO based out of Salt Lake City and Tampa. My brother and I also do a weekly podcast. Maybe some of y'all have heard it on YouTube and anywhere where you can find podcasts, and we talk about things like this every week. So you can listen to me blab if you like what we have to say.
So we're going to let you do most of the talking then too.
I'm all talked out, I think.
No, and I'm going to be on your podcast. How about that? Good afternoon. I'm Jonathan Lowe. I am the Director of Health Plan Sales for Baylor Scott and White, which is to say that I cover the Medicare division, both internal and external broker channels. In addition, I also cover commercial, which would be small group, large group, and recently I'm now over agent support. I have about 20 years in this industry, but before I came into this industry, I was also in the medical field for 4 years, to include organ and tissue donation. So I have a background in insurance, I have a background in medical, and I was also a broker, which I greatly appreciate all of you.
Fantastic. So I wanted to draw everyone's attention. They've flipped up on the screen the QR code for questions, and we will see those pop up. And that's really, from our perspective today, we've got three primary topics here that I raised here. Our time is short, and I think each of these could probably be 30 minutes on their own. But really want to encourage this. We want this to be more of a discussion, more of a back and forth. Love to have any and everybody engage us as we focus on these topics. If we're able to move beyond these, we've got some additional topics as well. But we'll start here with the first one as it relates to, we've touched upon here the framework here as it relates to financial, consumer-related, and producer-related topics as we think about the headwinds in the Med Advantage space. What does that mean as well for the MedSupp space? So the first perspective here, as we think about from a financial perspective, what are we talking about? We're talking about the continued rise in healthcare and drug costs, as well as claim cost trends, and that's sort of an open-ended topic. And I'm certainly happy as an actuary to talk through this a little bit, but interested, Chad, Mike, and Jonathan, from your perspectives, what you're seeing, challenges you're seeing as we think particularly about the financial side of things.
It's going up.
Man, a few words.
Yeah, I think we all know the intrinsic challenges that many of us are faced with, and it's impacting everybody, no matter what your role is in the value chain here at the end of the day. And the hardest part, as I think about it, is the end impact on the consumer. They may not feel it right out of the gate, but at some point down the life of having their policy, they're going to feel the strain of the costs, and because that strain ultimately, whether it goes in the group space, in the individual space, Medicare space, you name it, rising costs eventually goes to the shoulders and the burdens of the end customer. And that's the hardest thing to see, is the impact on them at the end of the day.
Yeah, look, everybody, we've all spent 3 days talking about the financial headwinds in the industry, and that's across all sectors, right? Everybody can see what's going on. But really, you have to look at it from a macro level, right? And it starts with the funding to this program, specifically Medicare, and we're in a pretty bad spot financially as a country, and we've got to do something about it. When we're spending more to service the debt as a country, it puts downward funding pressure on everything. So you have that compared with contrasted with all of the rising costs in literally every sector. Healthcare, every component of the entire ecosystem is seeing costs. We all live in the same world as well. We've seen inflation really make our lives much more expensive over the past couple of years, and you pair that with a really difficult financial situation from an overall macro perspective, and that's where we're at as an entire industry. So we've all got to play our part in the ecosystem of being as efficient and optimizing what we can in our component, and I think we comprise a good segment of the different ecosystems.
I would agree, and I'm gonna tell you all something. We just said it a moment ago. Pharmacy claims are the number one driver. Being on the carrier side, each one of you are seeing it with your members out here, and you're seeing it with the Medicare beneficiaries. But from the carrier side, where I'm also seeing it, a moment ago I mentioned that I also am over a commercial group. I see groups that come in with pharmacy claims that are twice the amount of the premium that they're paying per year. So when I'm talking to some of the group administrators and owners of businesses, for example, and they wonder why costs are going up, I sit down and have an open and honest, transparent conversation with them. I show them, and we go through pharmacy claims, and we take a look at it. But at the end of the day, that's a big driver out here. So when you're seeing medications going up, you've all heard about GLP-1s. You're seeing a lot of that out there and a push for them. You're also seeing the fact that your average senior, and honestly, we looked at some statistical data. Did you know the average 40-year-old is on about 5 medications? So we know that our average senior is on 5, but I would actually dare to say it's probably 7 to 10. And I've seen seniors on 30 different medications because, again, we're a plan with a hospital system as well.
The piece that I would probably add, in particular to Chad and Mike's comments a minute ago, is that seeing the markets, I feel that there's growing rational behavior from the carrier's perspective in terms of getting that pricing more right. I mean, particularly, maybe more so this was true on the MedSupp side, where we saw carriers oftentimes sort of hang on for dear life to the very low trends, even negative trends that came out of COVID. And that has just not been reality, particularly the last at least 3 years. And so I think finally the pricing and the decision-making as it relates to MedSupp premiums is catching up to where trends are. Unfortunately, while the market may be behaving rational, that does not appear necessarily rational to the consumer. And it goes back to those, to the perspective you mentioned a minute ago, that seeing those prices rise, it's not particularly comforting to the policyholder who says, oh good, the insurance companies now are getting their pricing right. So this is certainly, part of that challenge that we continue to see as well. And again, certainly as it relates to funding on the Med Advantage side. The other piece I'd add is, as it relates to Jonathan's comments on the Part D side, and as we think about prescription drugs, is that the MedSupp challenge is that oftentimes the MedSupp carrier and the Part D plan oftentimes may be at odds, even if a policyholder owns a PDP and a MedSupp from the same carrier, that oftentimes you may see those businesses siloed such that increased drug utilization is good for the MedSupp plan. It keeps the individuals healthy, keeps them out of the hospital, but it's bad from a financial performance perspective of the PDP. And the flip side of that is if there's lower drug use and the services flow over to Part A and B, bad for the MedSupp plan, good for the PDP. Ideally, and we've started to work with carriers seeing this, that trying to unsilo those two products, for lack of a better description, and have them share incentives, align behavior, and really try to ultimately do what's best for the consumer as opposed to more of that siloed approach. We'll move here now next to consumer disruption, and I know that all of these pieces as we think about this, and we mentioned 4 things, and again, sort of open-ending it to the panel here, but as we think about consumers' choices, access, the risk profile, as well as consumer economics, we've alluded to that as well, but interested in your thoughts.
Yeah, I guess I can go first on that. And it's interesting. I mean, Physicians Mutual doesn't sell Medicare Advantage, but I've lived enough in the space to be dangerous with United Healthcare. And I think I heard a stat earlier this week, 43%, I think at best, consumers actually have an in-network provider with an MA plan where they live. And so access is, we all know, key to healthcare. And you look at the average out-of-pocket maximums in MA, in-network is what, $9,300 and something, and out-of-network is going to be even higher than that. And you've got less than half chance of finding a good provider in your local community. Again, that's significant when it comes to how we can best support the end customer and consumer at the end of the day. And it's a challenge, right, for everybody right now.
Yeah, I'm assuming most of you all are agents, so I always like to come at this from an agent perspective of what can you expect when you go home from this conference today? What are your takeaways? And so I would, if I'm looking into my crystal ball, I would expect disruption to continue this year on the MA space and on the supplement side. As Chad said, we're gonna see costs increasing on the supplement side of things. There's a couple of other big things that are yet to be determined as far as the Part D and the demonstration period that we've yet to address as an industry. And so this year's gonna look, upcoming plan year 2026 is gonna look and feel much like last year, where things are laid in the industry. There's going to be more plans that do have SARs or service area reductions. Some of these carriers that have been on the tilt are probably going to tap out this year, in my opinion, with some of the disruption coming. And we're gonna see a continual, let's call it an optimization of some of these Medicare Advantage plans, where you're gonna see a scaling back of some of these sexy ancillary benefits that we've really become accustomed to in the industry over the past 4 or 5 years, where not every plan is going to be fully funded to be able to solve all the social determinants of health, right? Your Medicare Advantage plan specifically is probably not going to have the necessary funding to be to provide dental, vision, hearing, grocery cards, gas cards, the little pet robot dog, all those kind of things, are probably not going to continue or really be reintegrated back into Medicare Advantage plans for the foreseeable future. So if I'm you, I'm gonna do exactly what you're all doing right now, which is become extraordinarily valuable in the industry, know exactly what's going on, and then be adaptable to the changing landscapes of the industry. I think all of you should really get good at working with some of these ancillary and supplemental carriers out there, adding some dental, vision, hearing, still be continuing to meet your clients where they're at. But I would expect us to continue to see disruption through 2026 plan year, and then some stabilization going forward in the MA space.
I would agree. When we're taking a look at basically what happened to our consumers, we all know this past year was an incredible year of plan switchers. Being with a local Texas community health plan and not a national BUCA, for example, we saw a lot of disruption in our market. You're absolutely right, Mike. A lot of larger carriers decided that they were going to reduce service areas. I know there were provider network issues out here as well. Also, we were talking a few minutes ago about COVID. As you all know, for about a period coming in 2020 and in 2021, a lot of individuals out here were not getting their medical checks. They were not getting the services. They were not getting the elective procedures. So what happened is, coming into the end of 2021 and 2022, we started seeing an incredible spike up of utilization. And because a lot of individuals out here did not seek treatment and care when they needed to, what happened, that was another cost driver, because they went in, they found that conditions and medical issues were more severe. So when you took a look at what the landscape was, and last year being a year coming in with a political, let's be honest, probably one of the most polarized political elections we've ever seen in our history. And on top of it, you had impacts to carriers out here. So a lot of carriers were impacted by star ratings, we know. There were also Medicare reimbursement cuts. And it was said, the fact is, a lot of the benefits for Medicare Advantage were not sustainable. So you can't have your food card, your utility card, you can't have the robot, like you were saying. But what happened is, so then a lot of carriers had to kind of revisit and really take a look at their benefits designs. So carriers that were a little bit more conservative that were trying to cover the basic benefits, that were trying to cover the necessary medications, and making sure that the critical key services were utilized, those plans did a little bit better. But I know here in a minute, we're also going to talk about all of your roles in this as well. It was not an easy year for brokers and agents. You know, there was CMS's final rule that caused a lot of concern and disruption out there, so we weren't really sure how that was going to go. A lot of carriers out here also cut back commission structures. And again, let me tell you, being a broker, as I was, and I still have my book of business today, I know what it's like to work. I know what it's like to work long hours and not get paid. I know what it's like to work with a carrier and not get paid what I should. I know what it's like to have to fight for those things. So again, all of you had just unusual, extraordinary struggles for last year. And again, you were also seeing it with our community and our Medicare beneficiaries.
I think the pieces that I would add here, one is we haven't really touched upon, we had listed here risk profiles. This is something that I think is very much and has been high on the radar of both Med Advantage as well as MedSupp carriers. MedSupp perhaps a little more volatile as we come into 2025 with the disruptions in 24 for Med Advantage, the opportunities for people to move. I mean, I use the word opportunities like it's good. It wasn't necessarily a good thing, right? Service areas shrinking, plans shrinking, those sorts of things. But the opportunities for somebody perhaps to move back into MedSupp without underwriting, whereas they would not have had that chance without their Med Advantage plan changing. MedSupp carriers are very sensitive to how that risk profile potentially changed. They don't necessarily have the flexibility to rate for that until they see it come through in the experience. You know, early here, we're through first quarter of 2025. I think it's probably fair to characterize from the clients that I've worked with that the news isn't bad. That's not that the news is good necessarily, but at least some of the concerns as it relates to potentially, higher use, higher cost, enrollees coming in without underwriting as a result of moving from a Med Advantage plan. It's very, very early, but not necessarily seeing some of those concerns play out. The other piece, and Chad alluded to this earlier as well, is that one of the big things that you see on the MedSupp side, and certainly I think see on the Med Advantage side as well, is some of these, these disconnects in the way that the American healthcare system works, where a certain service gets provided at a hospital outpatient setting and it costs X. And that exact same service gets done in an ambulatory surgical center and it costs 2X or 3X. It doesn't matter to the patient. Either they've already paid their MedSupp premium or they pay whatever that copay is. But all of that impact, those dominoes fall and has an overall effect on where costs have gone without necessarily any change to the outcome for the enrollee. So this is, sort of the ongoing battle that's happening in our healthcare system as well. Chad, I think you were going to say something else.
Yeah, I was just going to add to the comments on the risk profiles, and I think I've got some product experts from our team in the room who could speak to this better than I can. But we've specifically assessed and looked at a lot of the switching profiles of people who were in an MA plan where the plan left the market. It's different if maybe the health system decides not to take it, right, and they have to find a different option. It's a different risk profile that we see there. But if a plan is leaving the market and they decide to go to Medicare Supplement, typically that risk profile is more risky. It's not a more profitable risk profile from what we are seeing. And so that also becomes a dangerous slippery slope where downstream that also can add more strain on the consumer because number one, trends have already been high across the industry. B, you're compounding some of those trends in specific locales where we have these changes. So you're compounding trend changes with trend changes, and we're all seeing the MedSupp rate increases that are happening across the industry. And for organizations or carriers like ourselves, where we pride ourselves on stability of rates, that's really straining that goal, right, and that mission that we have.
One thing I wanted to add is you're seeing more states go to or considering going birthday rule on the supplements too. And of course, what does that increases the risk profile as well, which what does that do to the rates? They go up, right? So, there's a whole host of challenges that you're dealing with on the supplement side of things as well.
Yeah, and the next part of that is just basic economics, as we have on our slide. You know, when you take a look at very diverse markets and you take a look at the impacts that financially that individuals and Medicare beneficiaries have had over the past several years, we did see a nice transition from Medicare Supplement over to Medicare Advantage. And again, there's obviously a cost driver to it as well. You know, companies were downsizing, individuals, again, were impacted financially, rising costs, all these things were factors in it. So one of the things we like to do is take a look at where does the membership come from? Number one, where are they coming from? Are they coming from a Medicare supplement plan? That would be one. Texas, for example, had explosive growth. So that was the other factor that sometimes you had to take into that, for example, Oklahoma may not have had an example of. But, for example, cities like Houston and Austin, for example, saw unprecedented growth. So that also caused a lot of strain economically. Costs were rising, housing, all these things impacted individuals. And, you know, I hate to say it, but ultimately, people generally will make cuts when it comes to healthcare. So this was one of the trends that we were seeing.
The last piece, you know, to what Mike mentioned a minute ago, as we think about access and we think about MedSupp and the rules are changing. I think, you know, the statistic that was out there, a session the other day, talked about now there's 16 states with at least some form of birthday rule, some form of open enrollment period. Typically, it's limited to those who are already in a MedSupp, able to move within the MedSupp market. Other states have a wider access, have gone further with that. Of course, there's two sides to that. We did some work a few years ago for a state who was looking at moving potentially to where like New York and Connecticut are with year-round open enrollment. So there's challenges there. They viewed that as a potential chance to widely open access to more enrollees. Working through this, and you know, I think state regulators are generally thoughtful around this. They realize that there's two sides to that access. On the one hand, while you may be opening the market, there's going to be a price impact there. Secondly, related is there was advocates that viewed that those who were dual eligible, without properly really understanding, you know, those individuals really are not going to be in any sort of income position to pay for MedSupp, that even though the market would technically be opened to them, it really wasn't going to be any more accessible than it was currently. So, you know, these are sorts of the challenges as well, as far as, you know, if you could open the market without changing price, that's truly changing access. If you're opening access while dramatically increasing prices, we're not necessarily sure that access is being affected, maybe even affected from a negative perspective. The last piece here, and all the panelists here, you know, certainly alluded to it, you know, expecting that, you know, many here in our audience from the producer and distribution side, interested as we talk through headwinds and contemplate MedSup's role in that, as well as we think about the MA headwinds, you know, the roles, responsibilities, and alignment with client needs from a producer perspective. Interested in your thoughts.
Yeah, I mean, this is a passionate area of mine. I spent many years in the field doing, I mean, I've always been in marketing and on the product side, but I spent many years in the field doing ride-alongs and community meetings and really helping to educate back in the early 2000s of the ABCs of Medicare. At United Healthcare, we came out with Medicare Made Clear. We spent a significant amount of time educating and informing customers or consumers to make a well-educated decision that was truly best for them and their situation, whether it's their income, whether it's their health status, and or what have you, their budget, right, through their retirement years, and really helping them to get into the right plan for them. This is an area where I want to encourage us as an industry to get back to the level of education and information we provided even back then. I'll be honest, I don't see as much education at large, right? There are some that spend a lot of time educating, but at large, I think education is the name of the game right now. And we need to help people make informed decisions as they're navigating something that's new to them. It was new to people in the early 2000s who were moving into Medicare. It's new to people today who are moving into Medicare. And so it's just a different population every year as people age in, and we're always re-educating and reinforming and helping people to navigate. And to me, I think that can help to some degree mitigate some of the systemic challenges that we as an industry and hence our customers feel at the end of the day.
Yeah, look, guys, I've been in this industry for a long time. I've been in this industry 17 years, started off as an ICA for United Healthcare back when MA was first being proliferated out. I had hair back then. So
that's why I didn't recognize you.
Yeah, so I've been in the industry for a long time, and I've seen a lot of changes. And there's a lot of potential doom and gloom that people are talking about, right? We're talking about expenses, we're talking about funding environments, we're talking about costs are bad everywhere, benefits are going away. It seems all very negative. I can tell you all right this, I've never been more bullish and optimistic about what we do. And here's why. Because all of you agents that are here right now that are willing to invest your time, your money into coming out here and being a professional and sit through a boring panel or some boring panels, hopefully we're doing a good job, and invest into your education, you are the exact type of agents that the industry needs. And I'm a really big fan of the selection process, right? You even heard Dr. Oz talk about it during his confirmation hearings. He says there's probably too many brokers in the ecosystem. And when times were good, when we were living through fantasy lands of, funding a funding environment that maybe wasn't in alignment with reality, you saw a lot of people enter the space. And now we're kind of on the other end of that. And it's going to benefit all of you agents that are the professionals. So, what your role and responsibility, what your takeaway would be, keep doing these things that you're doing. Invest in becoming an expert in your field. Invest in providing value to your clients and to your carrier partners that you work with. Because guess what? We all are always gonna have threats. We're gonna have the threats of, the funding environment's not right. There's going to be competition. There's going to be different political administrations. Whatever the future is AI, right? And you've got half the vendor floor over here trying to replace all the brokers with a future robot that's meant to replace us all, right? So there's always going to be a threat of, doom and gloom in the industry. But this should embolden all of you. You should leave this conference today going, man, I'm excited. I'm pumped up because it's going to be hard for some of these people, but I'm not like all those other agents. I'm an agent that's smart, sophisticated, and I'm willing to invest in myself, and I'm going to be a winner, right? I'm going to be able to provide value to my clients and my consumers, and I'm going to be an expert in my field. And as I do that, I'm going to be compensated like other experts in my field and be compensated commensurate to the value that you offer the industry.
Hear, hear, and agree. And I'm going to say for other carriers in the room, that's a big part of our job, is to help make that job of yours easier, right? We're with you in that situation. We've got to provide more tools, easier tools, and communication devices to help you do that, help you do your role easier.
Yeah, and sorry, one last quick thing is, somehow brokers became the villains in a part over the last few years, and we're having our compensation threatened and things like that. And so all of you, keep doing a good job. Go, advocate. Ask your clients to go get involved. You guys need to participate, and we need to speak out as a collective voice as agents. Because frankly, a lot of the administrators and the legislators and even the carrier partners to some extent, they don't necessarily know what we do and the value that we provide. I mean, we know we're where the rubber meets the road and provide a critical piece of that infrastructure, delivering care to these seniors. So let's keep it up.
I'm going to take it to one thing a little bit more controversial. At the end of the day, remember something. It's exactly what we're saying up here about the value that you guys bring, but you need to demand certain things out of your carrier partners. You need to demand education. You do need to demand the support. You need to make certain that you are being paid on time as agreed. I agree with you. You are experts. I was a broker myself. There is nothing worse than sitting here guiding individuals, making sure and protecting them, giving them the coverage and the guidance that they need. And remember, your beneficiaries, your clients are going to call you for so many other things because of the trust you engender. but you need to ask more of your carrier partners. If your carrier partners are cutting commission, then maybe you need to reevaluate who you're working with. If they're not providing you support, you need to reevaluate that. If they're not providing webinars, if they don't have field support, if they're not coming on regular visitations to your office, if they are not getting your beneficiary's issue resolved in a timely manner, if they are not coming, they are helping you train and onboard new agents, then my question is, why are you doing business with them? You do have a choice. Understand that there are carriers out here that are broker-centric, that do understand the value that you bring. Don't let anyone ever diminish what you bring to the table. Remember when ACA came out, they tried to replace you. How did that go? I was in the field. Guess what? You know what I did? I worked longer hours for less money. We all remember. Raise your hands. I know you remember it. How many times are they going to sit back and try to replace brokers? I have had interactions with other carriers that are saying, well, you know, they'll make an issue about a broker. I said, no. Where I come from and my perspective and what my health plan does, we absolutely bring our broker partners in. We do advisory council so we can bring them in and get their feedback. We go out and visit them. I, as a director, cover the entire state of Texas in our service area. There is not an agency that's not going to get a visit from me. I give my personal phone number out so they can call me with their service issues. How many others do that? Again, demand more from your carrier partners because you guys are valuable. You may not realize this, but let me give you a stat. On average, you're bringing in at least 75 to 80% of the business to the carriers. So there you go. Now, if you were a business owner and I came to you and said, hey, let's alienate 80% of our income stream, what would you gentlemen tell me? Yeah, bad idea. Exactly. No, I like that, actually. And being in Las Vegas, you can walk around and you can... But anyway, I just want to say in conclusion, again, please understand, that was one of the challenges when I came in as a new director, is taking a look of what levels can we support our brokers. I am proud to say that for those of us that were in the field, that worked as a broker, that understand and appreciate the value, we expanded those services and it makes a difference. So again, you demand more from your carrier partners. You tell them what you need, you tell them what you want, and you make sure if they have any committees or advisory, you get on them.
We have a couple of questions here. I'll try to tackle these briefly. Question around MedSupp and what it may cover or how that may be expanding. The nature of MedSupp, with it being at a state, I think states are continuing to be more open to the idea of adding things along the lines of, it mentions here, dental, vision, hearing, routine physicals, what else might be done from that perspective. I think states are more open-minded to try to narrow that gap between where MedSupp is relative to Med Advantage, but it's an iceberg in terms of the pace that that's happening, but there is movement. The question here at the top, Dr. Oz said he would tackle upcoding among MA plans if confirmed. Would that help the financial headwinds being discussed? I think it would be. I think, the complex sort of Byzantine nature of coding and what is truly upcoding compared to what is better data. I think that's perhaps the fundamental challenge in what Dr. Oz mentioned there. Question about states that are implementing the birthday rule. If whoever it was that asked that question, we have some current information. I'd be happy to send that. Connect with me, nick.orner@milliman.com. Connect with me via the Medicarians website as well. The question around envisioning the birthday rule or policy anniversary rule in all 50 states. This is an interesting question because the MedSupp rules and the opening, the liberalizing of rules used to be more of a blue state compared to red state, more typically Democrat leaning as opposed to Republican leaning. Those lines have been blurred recently as we've moved to 16 states now having some form of that, 8 more with at least the wheels in motion towards moving to that. It's much less a politically divided issue. I think red states have seen this as a winner. Blue states haven't necessarily seen it as a winner. So those lines have certainly been blurred.
Commissions on PDPs? I don't think so.
Yeah.
Because the Part D demonstration, there's another shoe that needs to drop there, guys. There's probably going to be some funding mechanisms that are pulled over from the MAPD side of things. So I think some of those situations are going to continue, and CMS may step in on some of the commission stuff, or they may not.
And with that, again, appreciate everybody's time. I think, we've collectively said what our charge is, telling stories, helping insurers tell that story, and have a great rest of your week. Thank you.
Take care.